Welcome to Infection Navigator. Today, as we navigate through the shifting tides of global health, we find ourselves at a critical crossroads. Across continents and climates, viral threats are stirring once again. From the rural communities of Texas to the forests of Central Europe, and the wild frontiers of Arizona's deserts, outbreaks are testing the resilience of both human and animal health systems. In the United States, a disease once considered nearly eliminated has made a troubling return. Measles, one of the most contagious viruses known to humankind, is spreading rapidly. Over 700 cases have been reported in recent weeks, and the state of Texas is facing the brunt of it. Gaines County, in particular, has become the epicenter, with over 560 infections confirmed and 2 tragic child fatalities, both unvaccinated. This resurgence highlights the dangers of declining immunization rates and the vulnerability of communities where vaccine misinformation takes root. Measles, though preventable through the MMR vaccine, continues to remind us of the fragility of herd immunity when public trust is eroded. Meanwhile, in the sun-baked deserts of Arizona, another silent threat is growing: rabies. Reports of infected skunks, foxes, and bats have increased sharply. This zoonotic virus, almost universally fatal once symptoms appear, poses a serious risk to unvaccinated pets and, by extension, their owners. Health officials urge pet owners to double-check vaccination schedules and avoid contact with wildlife. It's a poignant reminder that even in the developed world, nature still holds a viral arsenal. Crossing over to Europe, we encounter a different battlefield, not human, but agricultural. Foot and mouth disease has erupted in livestock populations across Hungary and Slovakia. Thousands of animals have been culled in a desperate attempt to contain the virus, which spreads swiftly among cloven-hoofed animals and devastates the economy of affected regions. Border controls are being tightened, and trade restrictions have rippled across the agricultural sector, raising concerns not only about disease management but also food supply stability. While these outbreaks escalate, global leaders have gathered to shape the future of pandemic preparedness. The World Health Organization has reached consensus on a draft pandemic treaty, an international framework designed to ensure coordinated response in future global health emergencies. The treaty emphasizes equitable access to vaccines, surveillance transparency, and data sharing. Yet, the treaty's non-binding nature has drawn criticism. Experts argue that without enforceable accountability, the lessons of COVID-19 may not translate into real, lasting reform. Each of these developments, whether it be the resurgence of a classic childhood disease, the wild transmission of a neurological virus, or the economic impact of animal infections, serves as a vivid chapter in the evolving story of our relationship with infectious agents. The lesson remains the same: prevention, preparedness, and science-based public health policy are not optional. They are essential. Stay alert, stay informed, and stay curious. This has been Infection Navigator.